Good morning, everybody. Good morning, everybody. Thank you. Thank you. So let's get started. My name is Ashish Kumar. I'm the faculty director of the Harvard Global Health Institute, and I want to welcome all of you to what is a very exciting and I think important day for us and for our community as part of Climate Week. Today's symposium, Human Health in a Changing Climate. If we take a step back to about 100 years ago, a century ago, about 1 in 3 children who was born on this planet died before the age of 5. That number has been cut by about 90%. We have made over the last century enormous gains in human health. But there is a threat in front of us that I want to just talk about briefly that threatens to reverse those gains. And that threat is climate change. And that's what brings us here today. Because unless we act, we will face a reversal of so many of the gains that we have had in children's health, in women's health, in all of our health. And so today is a day of reflection. It's a day of learning. But I think today will be most useful if at the end of it, we can all commit to doing something more and something greater on what I would argue is the most pressing public health challenge facing us, and that is climate change. So action, which is what brings us together, is enabled by leadership. And I want to introduce our first speaker to give some opening remarks, and this is somebody who really needs no introduction, Drew Faust. President Faust is the 28th president of Harvard University, the Lincoln Professor of History. And what she has done in her leadership role is commit the university to tackling the most important challenges facing the people of this planet. And that has taken on many forms. It has taken on forms like supporting and enabling the Climate Change Solutions Fund, which has been deeply involved in making sure that we reduce the carbon footprint of this university and engage much more broadly across the globe on reducing carbon pollution. It has also meant what I would argue is an enormous support for our engagement on global health. And I feel it most directly as the director of the Harvard Global Health Institute, but it has taken lots of forms in the way that Drew has supported and engaged with the entire university on improving the health of the people of this planet. And so when we were planning this event and thinking about how do we bring the community together to talk about the interface between climate change and health, we all agreed that there was no better person to get us started than Drew Faust. So ladies and gentlemen, let's welcome President Drew Faust.
Ashish, thank you for that very generous introduction, but more importantly, thank you for those powerful opening words. I think of a word that gets used a lot in public discourse and academic leadership language, which is the word compelling. And I think we don't often consider what it means. And I would say here it's really appropriate. Those were compelling words that compel us towards action in a way that is appropriate and urgent and necessary. So thank you very much for that. We're grateful to you and to all of your staff for organizing this event and so many others to bring our community together and to bring people from the wider world to join us in these very important issues. We are, of course, living, as the saying goes, in interesting times. I just spent 4 days in Washington, D.C., where it's especially interesting. But what we see that is particularly alarming to all of us is unfounded and unwarranted skepticism about science, about the facts and the value that it produces. This permeates public discourse across our country. Research that's essential to national and human progress is under assault, and the expansion and perpetuation of knowledge seems, for the very first time in my lifetime, to be something that none of us can take for granted. So how has HGHI responded to these changed circumstances in which we find ourselves? In February, the Institute, in conjunction with Al Gore, the Climate Reality Project, and other partners, quickly convened a climate and health meeting in response to the abrupt cancellation of a summit planned by the CDC for that time. Experts from around the globe gathered at the Carter Center to discuss the undeniable links between climate change and human health, and to talk about the cost of inaction. Today's event is a continuation of those very important conversations. We gather today less than a week after the nationwide March for Science powerfully underscored the commitments and convictions of people across the country. And we come together with a sense of renewed urgency and resolute purpose. As Ashish and Dean Michelle Williams put it in a recent op-ed, climate change is upon us. We can no longer think of it as an issue of temperature changes or sea level rises alone. We must remember that we will feel its effects most acutely on our health. The work of HGHI is more important today than it ever has been before, and I'm so pleased to see Harvard playing a crucial role in supporting essential research and driving progress for the sake of communities around the world. And as I mentioned earlier, I have continually this spring traveled to DC to advocate for basic and applied research funding and to try to make elected officials more aware of its impact on how we live today and how we will live tomorrow. Climate change is one of the most pressing problems facing humanity. And as we work together, I'm reminded of some words of John F. Kennedy, whose 100th birthday we celebrated at the Kennedy School just last week. He was a president who inspired the nation to seek the extraordinary potential of science to improve the future. He said, "Our most basic common link is that we all inhabit this small planet. We all breathe the same air. We all cherish our children's future. And we are all mortal." Important words to remember as we think about the future. Thank you so much for working to articulate just how important those links Kennedy described are. And now it's my great pleasure to introduce a wonderful partner in that effort, the Dean of the Harvard T.H. Chan School of Public Health, my colleague, Michelle Williams. Thank you.
Good morning, everyone. I'm really happy to be here to be part of this series of discussions around climate change and human health. And so I want to add my welcome to those that were offered by Ashish and Drew. As you know, health is the human face of climate change, and there is no greater threat to public health than climate change. Rising temperatures, changing weather patterns threaten our very, very important physical safety, our nutrition, and our ability to live and work in areas of the globe. We are still only at the beginning of appreciating the full health impact of climate change and how to translate research into strategies for mitigation and adaptation. But if we do not address this challenge, as you heard from Drew Faust, the cost of inaction is great. If we don't address these challenges, the gains that we've made over the past century in crucial public health areas, such as the reduction of under 5 mortality, will be erased. And for those of you who read Nicholas Kristof, one of my favorite writers, the gains we've made in improving the lives of women and girls, the gains we've made in pushing down child marriage, for example, in places like Madagascar, will be reversed. Some would argue are being reversed as we speak. Universities have a unique responsibility to study and draw attention to crucial scientific and social issues, particularly those that have meaningful impact on people's health. Studying and confronting the health impacts of climate change is a key priority, as you heard from President Faust and from Professor Ashish Jha. A very key priority area for our school, the T.H. Chan School of Public Health, but also for the Harvard University. And it's key both in the area of research and teaching, and I will add in the practice of helping to identify and create solutions, so broadening the space for solutions to occur. This fall, we will be welcoming our inaugural class of master's students in the Interdisciplinary Sustainability, Health, and Global Environment program. And this program will begin to train leaders and practitioners in the field of sustainability. And I'd like to think that this program will expand the solution space for a very important planetary threat that affects us all. Over the past year, the collaboration of the Harvard Global Health Institute, we have supported a wide range of programming in this area. In December, I spoke at a symposium on the health co-benefits of climate mitigation measures. In February, as you heard from President Faust, after the CDC, Centers for Disease Control and Prevention, canceled an important meeting on climate and health, the Harvard Global Health Institute collaborated with the American Public Health Association and former Vice President Al Gore's Climate Change Reality Organization to ensure a version of the meeting took place at the Carter Center in Atlanta. And I was there, and I still remember and draw power from that very important day of high-level science and political defiance, because we pulled off that meeting with very short time frame, bringing together people from across Harvard University, across the public health practice landscape, and governance leaders to make this meeting happen. Today's symposium is a continuation of that meeting in Atlanta, and it builds on the groundswell of attention to this area of public health research and policy. It gives me great pleasure to introduce Gina McCarthy, today's keynote speaker. Gina is an environmental health and air quality expert who continues to be a thought leader and a leading advocate for common sense strategies to protect public health and the government. Gina was appointed by President Obama in 2009 as Assistant Administrator for EPA's Office of Air and Radiation, and was named EPA Administrator in 2013. A longtime public health servant and progressive leader, she previously served as Commissioner of the Connecticut Department of Environmental Protection, Deputy Secretary of Massachusetts Office of Commonwealth Development, and Undersecretary for Policy for Massachusetts Executive Office of Environmental Affairs. During her illustrious 30-year career, she has advised 5 Massachusetts governors on environmental affairs, worked at both the state and local levels on critical environmental issues, and helped coordinate policies on economic growth, energy, transportation, and the environment. Of her many contributions, Gina considers the start of the Regional Greenhouse Gas Initiative, the first cap and trade program for greenhouse gas emissions in the United States, to be one of her major environmental achievements. A native of Boston, Gina graduated from the University of Massachusetts, Boston, with a bachelor's in arts and social anthropology. She later attended Tufts University, earning a Master's of Science in Environmental Health and Health Engineering and Policy Planning. She is an Institute of Politics Fellow at Harvard Kennedy School of Government and a Menschel Senior Fellow at Harvard T.H. Chan School of Public Health, where she has taught a class on environmental leadership, integrating science, public health policy, and political rhetoric. Before I ask you to join me in welcoming Gina to the podium, I want to share with you just a little vignette of my first encounter with Gina. She was just beginning. Don't look shocked. She was just beginning the Menschel Fellowship, and she met in my office with academic dean Karen Emmons. And we quickly got into a discussion of how can we do more, how can we do better, how can we engage more of this country's citizenry in helping to build and grow that solution space that I refer to. And I talked a lot about my own personal shortcoming in feeling comfortable talking in town halls, and how I'd spent all of my life really honing my communication skills to talk to people like you, other academics, students, but not to the general community. And Gina just broke it down. She said, you people just have to lead with what you know. Don't start with the uncertainties. And as an epidemiologist, that's where we always start. She said, lead with what you know. Share what you know so that you can inform to activate. And that's a pivotal moment for me that Gina brought to our school, and I know she continues to do this to everyone who encounters her in the space of our school at T.H. Chan and in the space of the Kennedy School, and today broadly across the Harvard campus. So please join me in welcoming one of my new mentors, Gina McCarthy.